And today's subject is about the physiological law of hypersensitivity denervation, or denervation hypersensitivity. So you probably never heard of this, but it's something that I had never heard of in medical school back in Scotland, and I'm sure it's not taught at regular universities. But it's something I came across back in 2003 when I moved from Scotland to Canada, and I was training with Chan Gunn, who is an world leader in the area of chronic pain, who developed his own dry needling technique from basic principles on this very physiological law. So let's go back in time. Professor Cannon, he was the eminent professor of physiology in Harvard back in the early half of the last century. Now, in his amazing career, not only was he appointed professor in Harvard, but also in Paris and Beijing. And he discovered three basic physiological laws. The first is the flight principle, which we all know about if you've got any idea of physiology and how the autonomic nervous system works. And it was during his time in World War I in Europe that he learned about trauma and patients or soldiers bleeding and what happened physiologically. And he, from first principles, figured out this law of adrenaline pumping from the adrenal glands, and as a result, the fight-flight response in the shock situation. And that can be talked about in a big way in trauma, and also the busyness of our lives, and also in the chronic pain state. The second law he discovered was homeostasis, which means the balance in every cell of your body, balance in every system of your body, like the cardiovascular system, like your heart rate doesn't keep going up forever. It comes up and down, up and down. You got the pH, say the body chemistry and the hydrogen ions in the body, there's a balance there. And also when you look at the whole body, we need to be in balance with our environment. You know, we can't be living in 100 degrees Celsius. You know, we've got to live in temperatures that are more akin to our own temperature. So our environment and the internal environment needs to be in homeostasis, and this is essential to health. So his third law was called the law of denervation supersensitivity. And to paraphrase it, if you damage a nerve, it becomes super sensitive. Now that makes sense if you hit your funny elbow. So you hit your funny bone, your humerus here, and you'll trigger the nerve and you get a zinger down your arm and you feel sensation. Well, what happens in a chronic trauma state is the nerve gets stimulated so many times that it becomes super sensitive. Now here in Vancouver at this time of the year, it's late September 2019, then many patients will be coming in and say, yeah, my pain's worse because the weather's worse, because it's raining. And we all know that most people who've got osteoarthritis or chronic pain, they know that their symptoms get worse in the changing seasons. And the reason for that is the law of denervation supersensitivity, because what's happening is the nerves that over time are being shaped and changed. It can be done by traumas, like old accidents. It can be through aging, the aging process. Young people don't typically feel weather changes in their joints, but older people do if you hit 40, 50, 60, 70, 80, etc. Other reasons can be surgery, that I see a lot of. Tightness in the tissues result in a hypersensitivity of the joint or the muscles. And the fourth reason is stress. Busyness of life, internal stress, external stress affecting us, all contribute to this super sensitive nature of our nerves. And the nerves can be sensitive over 100, even up to 1,000 times, and therefore you can pick up the barometric pressure changes in the body. So when the weather changes and you feel sore joints, say sore knees or sore neck, sore back, and you know, you may have heard people say, yeah, that's the weather changes. Well, actually what I think is going on is, yes, there's barometric pressure changes. Yes, your nerves pick it up. Yes, your nerves have been oversensitized, but also there's an instant conditioning of the brain. And then you have the belief that the weather is causing the pain. And that belief drives the autonomic nervous system, and the whole hypersensitivity continues. Because I myself had the experience of having this in the past. And since my pain in my knees, for example, have resolved, I don't get that sensation with walking down hills. I don't get that sensation with weather changes anymore. So that's the law of denervation supersensitivity. And how it really presents is tightness. All of us as we age have tightness in our body. It happens with these four things that I mentioned: stress, aging, surgery, and trauma. And tightness then leads to constriction of the peripheral nerves. That's these tiny little nerves around the tight tissue, are called fascial tissue, constricts the blood vessels and increases the sensitivity of the nerves. And I think that's why we get this, because of the tightness is causing the hypersensitive nature. And then the question says, well, how can you help me? You know, Dr. Wayne, how can you help me with my pain? Well, how do we get rid of tightness? And there's kind of three or four things I want to mention here. The first is keep active. If you don't have pain, do exercise, do some stretching, go to yoga. Very, very important. I think everybody should do this to a degree. But if that's not working out, you maybe go to therapy, physiotherapy, get moving, kinesiology, get some active exercises going, massage therapy, get manipulation into those tissues to shift the muscles and the fascia, maybe that would help. Or a good chiropractor who does soft tissue work. Lots of chiropractors do a variety of treatments, but many of them do soft tissue manipulations, as do good physiotherapists who are very well trained. So these are different techniques where you may find relief of tightness in the areas that you're in pain. Now, if that doesn't work, the next thing that I believe you should get done is to release the fascia and the muscles through trigger point injections. And this is what I've developed in my practice over the last 4 years with this understanding of tightness and the law of denervation supersensitivity. Because when you put a medical needle into the tissues that are sore, it could be the back or the neck, any area that's got muscles, or it could be a joint like the knee, the ankle, even the wrist. And if you've got tightness there or pain there, you release the fascial plane or the fascial layer, which is just a thick tissue layer, then you can release the tightness around the nerves, and the sensitivity goes down and the pain goes down. And I found that a very successful treatment over the last few years. So for trigger points, you may think, well, where can I get that? If you're in my vicinity in the Vancouver Regional District, east of the Portman Bridge, that's in Surrey, in Langley, in Abbotsford, and also Agassiz. So all really covering the whole distance south of the Fraser River from Surrey to Hope. You can look me up on my website, WaynePhymister.com. And for most of my clinics, you can get a phone call referral. Just phone yourself in, get an appointment. That's in Surrey, Langley, and Abbotsford. You may have a little bit of a wait, but you can get seen right on from the wait list without a doctor's referral. So that would be my recommendation if you're east of the Portman Bridge. If you're the other side, maybe in Vancouver, I recommend Muscle MD. My colleague and good friend Rav Danoa runs these two clinics in Delta and Vancouver. You look him up on Google. And then over on the island, my colleague Dr. Greg Serin does a wonderful job at Victoria at the Mayo Clinic. Now, there may be other practitioners who do this technique. Look them up from your area on Google. And if you're outside Vancouver, there will be places. I know I trained a good colleague of mine up in Prince George who does it. And there's people all around the province doing this technique. You just need to do a little bit of research to find them. And if you're outside the province, then you can again look at your locality. So trigger point injections is really important to release the fascia and therefore the muscles, and therefore help your recovery. And what I do find with these treatments is once people have their releases done, then their therapy works a treat. Exercise can work, physio, massage, chiropractor can take the patients to that next level of ongoing therapy if that's what they need, or simple just self-maintenance with maybe foam rolling or stretching, yoga, or good old aerobic exercise. So there you go. There's the subject matter of tonight. I hope you found that was interesting. Please leave your comments in the comment box. Send me an email at drwaynePhymister@gmail.com and I'll get back to you. And I'd like your suggestions. What would you like me to talk about? What would you like me to dive into deeper that you've maybe heard me before, or other subjects related to pain? So I'm just going to wrap this up now. I thank you for listening, all you attendees. I'm looking at a few names here. It's great to see that you've turned up, and I look forward to next week. Thanks so much. Bye for now.